Okay, good afternoon, everybody, and thank you for taking some time to join us today for this talk, Next Gen AI for Today's Implant Maintenance. I will hand it over to Dr. Joseph, but first give you a short overview of his background. He did his undergrad at Tulane and then received his DMD from University of Pittsburgh and completed his periodontal residency at LSU and has been running a private practice in the Baltimore area for over 20 years. His interests, aside from educational outreach and continuing to stay on the cutting edge of new technology, is also integrating those technologies into his practice. So today he will talk to you about some thoughts and new tools in that arena. Dr. Joseph, over to you.
Thank you, Rachel, and thank you everyone for taking time out of your busy day to join us. I'll try and keep this as interesting as possible because it is a quite interesting topic. And really what we're discussing today is a new product from Integral Dental. And they've developed a diagnostic test for peri-implantitis. And this is a new way of looking at diagnosing and managing peri-implant diseases. This is a test that uses next-gen DNA sequencing aligned with computer AI models to help give accurate diagnosis and treatment action plan that you can report to the patient. It's a low-cost test, and this is new technology dentistry, but it's not quite new. And really, if you're in private practice periodontics and you've been practicing for longer than a few years, you realize that implants have problems, and they most often are related to periodontal disease. And managing those issues is of the utmost importance to help keep those implants functional and stable and healthy and cosmetic over time. And I'm sure if you're looking at the slide, you'll see these numbers on the left. 10% of implants will fail. It's not terribly out of line. 20% of implants are going to get some sort of peri-implantitis involvement. 40% of our implants that we see in our practice will have some sort of mucositis or peri-implant inflammation. And when we have problems with implants and trying to manage them in our practice, especially when we've placed them or if we're sharing patients with other practitioners that have placed implants, it's tumultuous to say the least because they have a lot of investment. And as a periodontist, I have always believed that being proactive and managing disease is much better than treating the actual disease. And now we have a test to help us really manage that and measure that. And this, I would say, is not just unique for implants, but this is unique for dentistry in general. We have never had a really accurate bacterial test. And so now that technology has evolved and Integral Dental has married that with AI learning, we have a new powerful tool that we could use. Some of the issues that we encounter in trying to manage peri-implant disease is that there's really not a hard, set, and fast rule set for diagnosing implant disease. And so there's multiple different beliefs. And even with that, we're not really good at diagnosing it. So despite all those different beliefs, we all are about the same at being accurate on whether we diagnose peri-implant diseases correctly. So going back to this very popular study, which really I think drives the nail home, in a 5-year study, peri-implant mucositis was noted in 63% of patients and 30% of implants. So we have a large population of people that have some inflammation around their implant. 20% of patients go on to develop peri-implantitis. And so there's a real chance there to help stop the progression of the disease if we can diagnose and manage it faster. So prevention is key. Maintenance, management, not just at the home care level, but on the professional level. And this helps protect not only the patient's investment, but also your bottom line. Repairing things, redoing things is extremely costly to your bottom line. And using technology to help minimize that only really makes sense to me. So that is a great segue to this next slide. I firmly believe that if you're not using newer technology and staying up to date with the times, one day you'll look up and realize that you're behind the times. So as I was alluding to earlier, Oracle PI by Integral is the only diagnostic tool for peri-implant disease diagnosis. And it's a fairly easy flow. It's not anything unusual. Dental plaque samples are taken. These are easy samples to take with a small curette or a small swab in the sulcus. Then you send it in the package to Integral. And then what's interesting about this is they use their DNA processing to not only get a good idea or an accurate idea of the kinds of microbes that are there, but the levels of microbes are there. And that's where this differs from any other test that's been. And it makes sense. It's not necessarily if you've got a bad bacteria there, how many of them are there, and how many of them are part of the general population, and who are the other players? Are they bad guys too? And that gives you a really more accurate idea on whether you have someone in the cascade of peri-implant disease. Then they use that in their AI software to give you personalized recommendations and really accurate diagnoses on what you're dealing with and how to deal with them. So, to review, we all know what healthy implants look like. They got a lot of keratinized tissue. There's no bleeding. There's no inflammation. Everything is nice and pink and solid. Peri-implant mucositis is much more difficult and elusive until it starts to advance enough. Oftentimes, there's a lack of attached tissue, and these implants need a good amount of attached tissue to really stay stable and healthy. They need to have enough fibers wrapping around the head of the implant that you can create a biologic seal, which is what makes implants so prone to peri-implant diseases. Peri-implant mucositis is reversible, and so this is our chance to intercede and prevent further destruction of the bone around the implant. In the past, what we would do is we would, examine the patient, we would probe, we'd take an x-ray, and, if it didn't really seem like a major issue, there's a little bit of bleeding, okay, we wouldn't really do anything about it. And eventually that can be a problem. Peri-implantitis is where the definitions start to become a little looser and we don't have a real set definition. So peri-implantitis for me means progressive bone loss around an implant, more than a couple of threads and bleeding on probing, a couple of threads exposed and bleeding on probing. I'm not so sure I care about the probing depth. If it's 5, it's at 4. If there's radiographic evidence of those changes, then probing depth is not as much of an issue. But certainly the deeper the probing depth, the more concern we have for a more advanced problem. So whenever it comes to peri-implantitis, it's always worse than you think. When you look under the hood and you really get involved and manage these problems, it's complicated and you wish you never really had to go there in the first place. When you have cases in the anterior that start to develop peri-implant disease, trying to manage that and maintain a cosmetic outcome is extremely complicated. Failures in relation to peri-implant disease, along with other risk factors, you really are devastating, costly to you and the patient and time. So in the past, what we used to do, which if you'll focus on the slide, the top row is sort of the status quo of how things are currently done. Patient comes in for a check or a new patient exam. We're about 60% accurate at diagnosing whether there's some sort of implant disease going on. Then we kind of pick a plan. Well, how bad is it? What am I feeling today? Am I going to increase their maintenance? Am I going to put them through a laser therapy? Am I going to use antibiotics to manage this? And even with that, in a typical general practice, and this probably holds true to a lot of treatment plans, about 66% of those patients are going to actually accept the plan. So one of two things happens, either no intervention or inappropriate intervention, and then it's often referred out to a specialist. And then more aggressive or advanced treatment is needed. This leads to a new methodology and a potential to intervene in a more modern and accurate way. But at the new patient exam, you have patients with implants. There may be some suspicious signs or some bleeding, lack of attached tissue. Hey, let's test that for peri-implant disease and see if there's a problem. You'll get a third-party opinion. You will have an accurate assessment of the kinds of bacteria that are there, the relative abundance of the bacteria there, so you can determine if this patient has more risk of progressing into peri-implantitis more rapidly. And you can track this data over time. How healthy have you made the patient? Let's think about our full arch patients. Testing their implants to understand if there's disease processes would be invaluable, because trying to manage that once we have a problem under a hybrid or an FP1 is extremely complicated. And let's face it, implants can be the most, or one of the most profitable procedures we can offer. But when failures occur or redos need to be done, that really eats away at that profit. And you can use early interventions and early diagnosis as a way to boost profits and prevent problems and make yourself, your patients, happier and healthier. So peri-implantitis is never going to get better on its own. It's only going to get worse. And the progression can be fairly rapid. I find periodontal disease seems to progress much more rapidly around implants when it's there than it does around teeth. And you only have a limited time period before surgical intervention is necessary. So early diagnosis is paramount. And, here's the elephant in the room. This is what we're up against. We're up against excess cement, dated implant therapies where there's no platform switching, so there's automatic remodeling of bone, which expose threads or rough surfaces. There's periodontal disease. There's the location of the implant. How well was it placed? How's the occlusion? Was it cemented? We have a lot of other factors really working against us with implants. So managing bacteria is the one thing we can really control. Now, what's really interesting about the test, Oracle, is its history and what it can offer us. So they've basically collected the DNA plaque samples from several worldwide studies. And of course, we found there's the usual suspects. Then they used machine learning to deep dive into the patterns on the progression of disease associated with each bacteria or family of bacteria. So based upon that information, a decision tree of treatment algorithms was developed so that multiple stages of diseases can be managed. On top of that, what you learn from the test is not only a really deep learning level of what bacteria are there, but also in what abundance. And that can really help you distinguish between, early or late stages of disease. So the machine learning methods help us determine the levels of bacteria in relative abundance that will cause disease or maintain health. And that's the differentiating factor between this test and any test that's been before. In the past or currently, all we really have is the oral DNA test. And in my experience with that test is I'll get information about what bacteria might be present, but I might have a person that flags all the purple ones, all the really bad bacteria, but yet clinically they're doing okay. So one of two things is happening. Either the test is wrong or the test is telling me, well, this patient has the bacteria, but maybe low levels of it. And so we don't really know how to use that information in private practice to a patient. Whereas this test will give us a definitive idea on the disease risk based upon the relative number of bacteria in the population present. So this should be a fairly familiar slide to anyone who's gone to a periodontal residency, and you'll see the early, bridge, and late stage colonizers that differentiate between how aggressive the disease will progress and how advanced the disease is. And, there's two main players that we all know about, F. nucleatum and P. gingivalis. But what we're starting to see is not all P. gingivalises are the same. Some are more virulent than others. And so with genomic sequencing, we're able to determine which ones are the more aggressive ones, which ones are the less aggressive ones. And that gives us a much more accurate idea of what we're dealing with clinically. So the algorithm is essentially categorization of the level of disease and then figuring out how that relates to health. So you can figure out easily what bacteria are there for the healthy people, so we can get tests back saying, hey, this person is healthy, and quantify that. And then we can also quantify, is this person in an early inflammatory stage? Are they at mucositis? And is there a great way to intervene? If so, are these bacteria prone to being able to be treated with specific antibiotics, namely Flagyl or Cipro or amoxicillin or clindamycin or combinations thereof? When it comes to the healthy versus peri-implantitis, we can also now determine, is this more on an implantitis or a mucositis level, and then direct our treatments accordingly. So we still do all the same things. We still take our photos, measure attached tissue, do our probings, take the appropriate x-rays, check out occlusion. But things like this can be avoided. So here's the patient, and visually you could tell there's a problem there, but you can't really discern the severity. And nobody wants to manage this in their practice. The cosmetics and trying to manage this post-operatively are really, really difficult. And this is potentially something that could have been avoided by determining if there's some peri-implant problems happening earlier versus later, and managing treatment and response. So we know there's lots of ways to handle mucositis. There's scaling and root planing with appropriate instruments. There's air abrasives, which have some promising technology these days, especially with that EMT system. Laser therapies, and there's vast and many amounts of laser therapies on the market. Local chemotherapeutics and antibiotics, systemic antibiotics, along with mechanical debridement. Mucositis is manageable. Once we have bone loss and threads exposed, we have to manage that surgically. And I hate doing surgery on implants that are there. It's one of the most tedious and difficult things to really do well. And the responses are varied because we're dealing with threads and obviously bacteria problems. I do find that managing these by knowing what the suspects are, bacteria testing, helping along the way is very helpful. And, there's some interesting ways to look at prevention. You can look at prevention as a potential help to your bottom line. You're offering a test. That test has a fee. There's a benefit to the patient and to you. and it's a win-win situation, and it's something that you can utilize in helping deliver better care to your patients, helping your patients realize when care is needed. If you're a referral-based practice, this is a great way to differentiate yourself from other practitioners by showing this much more modern, advanced, accurate way of diagnosing problems around implants. And Integral believes that you can increase your bottom line. I certainly believe increased patient retention is very feasible with this. And there's more to come. I'm sure if you're like me, you're thinking, well, wait a minute. If this tests for bacteria around implants, can't we? And the answer is yes. And those are coming down the pipeline. With the link of certain periodontal bacteria with many other disease factors, cardiovascular diseases, Alzheimer's, certain cancers, respiratory problems, kidney and liver disease. It's only a matter of time before we can link those with other with our periodontal tests and manage them much better. So bottom line is using this test is very low risk. It offers significant upside and benefit to the practice. Integral is offering a discount code, if you can see in your upper right-hand corner. I think if you're like me and you have a lot of implants that are placed in your practice, and the longer you practice, the more implants you see because everyone else is placing implants as well. And when implants have problems, you're getting referrals for them. This is a way to differentiate yourself and market yourself as someone who's using the most advanced technology to offer the best outcomes, hopefully the least invasive outcomes to your patients. So thank you for your time. I appreciate it. If there's any questions, I was supposed to say put them in the queue, and I did not do that. So I don't know if we received any questions.
Thank you, Dr. Joseph. We have two questions, and I'll just I'll throw them to you, and you can take them. So the first is, do you use this in your practice, or have your referring dentists test patients and then send you the data?
So this product is new. I do use it in my practice, and our practice was part of helping Integral sample implants. We were sampling every patient we could get our hands on. The samples are easy. The goal, now that it's becoming available to market, is twofold. One is to use it in my practice as a flag. Hey, I'm here for managing periodontal disease, and I'm doing it in the most advanced way possible. But also, if I can get my referring doctors to buy in and understand that we can be much more effective if they're testing implants in their practice as well. And then it's everyone benefits. You're elevating the level of your referring practice. They're elevating the level of care and prevention that they offer in their practice. If something gets more advanced, they can come to you. They come to you with the test already, even better. If not, then you do the test. Great. I don't think it's one or the other. I think it should be both.
Got it. Thank you. And one more question for you. How do you talk to your patients about the test?
So the way I explain it to them is, just like any other bacterial test, hey, we're seeing signs of a problem. Your implant is having signs of bleeding. There might be signs of bone loss. We're concerned that you might be getting periodontal disease around your implant. And the best way for us to diagnose the amount of problem that we're up against and how to manage it most accurately is to test for the kind of bacteria that are there. So it's painless. It takes a second to do. We'll have the results in a few days, and then we can discuss a treatment plan. That's how I do it.
Great. Well, that was all the questions that we had. Thank you so much for sharing that with us. And thank you, everybody, again, for your time and attention.
Thank you, everyone. If anyone has any questions or wants to get in touch, my contact email, that's my personal email. Don't hesitate to reach out.